Osteophytes, bone spurs, should they be removed? My name is Dr. Story. I've been a chiropractor for over 23 years. I'm going to give you realistic advice based on my experience. The answer to this question is 99% of the time, the answer is no. The osteophytes and the bone spurs should not be removed. Osteophytes and bone spurs are very often the reaction to a problem, not the problem itself. I'm going to say 1% of the time, because we have to give you 1%. 1% of the time, those osteophytes and bone spurs can grow so large that they become the problem in and of itself. I'm going to give you an example. The most common area where people get bone spurs is in the shoulder, the spine, and the foot. Now I have a foot here, and what you're going to notice is this foot has all the bones, and this is the tibia. Now what ends up happening is most people will see a bone spur at the bottom of their foot. Very often they'll go to a doctor, the doctor will take an x-ray, they'll see the spur, and they'll say, you have a bone spur at the bottom of your foot. That's your problem. Is it really? The reason why bone spurs develop is a result of stress on that area. Very often, particularly in the foot, especially if a person is putting a lot of pressure on their foot, meaning they're running or they're standing on their feet, or they're just heavy set, they're bigger than their body can handle. There's a lot of pressure on that foot, so the body responds by forming more bone in that area as a protective mechanism. Bone spurs are usually a sign that the body is trying to self-protect itself. Spurs very often form where the ligaments attach to the bone itself. So if there's an excessive amount of stress on the ligament to withhold the pressure of that area, then calcium will start to develop on the ends and start to solidify, and that's how you develop a bone spur. This very often happens inside the spine, it happens in the shoulder, it happens in the foot. Now the purpose of this video is not to discuss everything about bone spurs, but to answer the question, should they be removed? I said 99% of the time, no. Here's the reason why. Because once you go in and you cut or remove the bone spur, the stress on the ligaments is still there. Eventually the bone spur grows back and you have the same problem. In many cases, the bone spur is there, you'll do therapy and chiropractic adjustments and give people exercises, their body feels tremendously better. Sometimes people actually feel 100% better, but we never remove the bone spurs. The bone spurs are there as a reaction to the problem. That's important to understand. So, when should they be removed? Well, when bone spurs grow so large that they start to cut into other tissues, now you've got a dilemma, a medical dilemma. You can go in and cut the bone spurs, and that would help the immediate problem of the tissue being cut into by the bone spur, but you just had a surgeon who now had to cut into you to get to that bone spur. So there's a recovery period for that, and in addition to that, once the bone spur is removed, you are in trouble because the stress, the original stress on the ligament, is probably still there, and you're probably still going to have trouble for many cases. Now sometimes the bone spur can be removed, you'll have a couple good years, but you have to deal with the original cause of why the bone spurs formed. That's the message of this video. If you thought this video was interesting, give me a thumbs up, subscribe to my channel. If you have any questions at all, ask in the comments section below. Be happy to answer your questions.